driving while under the influence of drugs such as marijuana, and Connecticut will take the lead on public safety issues. We'll then have a best practices and lessons learned session where the state of Colorado will talk us through their experiences, because they were, in many ways, the case of first impression, and they went through a number of iterations. So what did they learn, and what can we take from that? Basically, the point is, this is a challenge for all of us. There's a desire to do this. I believe the people of this state and our surrounding states have a desire to do it. But the old expression, the devil is in the details. How you do this is all the difference. And as I said, it can be a positive if done right. It can be a negative if it's not done correctly. So the goal is to collaborate with one another, to share resources and thinking collectively as we're all trying to figure this out. And to the extent regional coordination makes sense, why? Because we don't want someone driving from New York to Connecticut or from New Jersey to New York to buy marijuana and then drive back and possibly be using it in the car. So to the extent regional coordination makes sense and is politically practicable, we want to do that. Governor Murphy and I both sit on the Port Authority. Port Authority was way ahead of its time. 1921, regional coordination is the intelligent form of government. That was 1921. And the Port Authority has institutionalized that between New York and New Jersey. It runs the bridges and tunnels, et cetera. But it brings us together because it says, that's nice, you have your state lines, but you really operate as a region. And this extrapolates on that intelligence. This is a regional issue. And to the extent we can collaborate and do it as a collective, that is great. I understand all the reasons that makes that difficult, but that is the basic concept. With that, one other point. The federal government in situations like this would normally be helpful. In theory, the federal government is supposed to get involved in issues that go beyond one state's borders. That is not happening on this issue. It's not happening on the environment. It's not happening on infrastructure. It's not happening on anything. So Governor Lamont and I were together, and I said there's liberation in the acknowledgement that we are on our own. We are on our own. Stop waiting for someone to come in and help. We are on our own. In a small boat in the middle of the ocean. Start paddling. Let's paddle together. With that, I'll turn it over to the co-convener of this summit, Governor Lamont.
Well, thank you, Governor Cuomo, and my fellow governors. Look, coming out of the private sector, I thought government had a bad case of the slows, and it took us a long time to get things done. But working with Governor Cuomo, that is not our problem. I mean, we got together a couple of months ago, and we talked about all the things we're stronger doing together on a regional basis and what we can do in collaboration. We talked about cybersecurity. We talked about transportation, and we talked about cannabis and now vaping. And I said, well, that's great, Governor. Let's get together again next month to follow up on this. And he says, that's great, Ned. I'll see you next week. And I got to say, and here we are. It's 2 months later. And we've convened all of the states in the region. Our staffs are talking together, figuring out how we work together on all the key issues to make sure if we do this, we do it right. But it's just unconscionable, as the governor and I, when we were talking about on our fishing trip, you know, this patchwork quilt of regulations makes no sense at all. You know, my state of Connecticut, people cross the border, they drive up to Massachusetts where they can buy some cannabis and bring it back, and that makes some real problems for our state police. They've got folks from Massachusetts over the age of 21 coming down and buying vaping products. It makes no sense. So this makes sense. Sitting down, working together with New Jersey, working with Pennsylvania and our other neighbors to make sure what we do it on a standardized basis. We do it on a well-regulated basis with health and safety paramount. I think we're much stronger when we work together, and that's what this meeting is all about.
Great. Thank you. Thank you very much, Governor. Let's turn now to Governor Wolf, who made probably the furthest trip up from Pennsylvania. So, Governor, thank you very, very much.
Thank you. Yeah, it's good to be here. And I want to thank you, Governor Cuomo, and Governor Lamont for co-convening this and getting the ball rolling on regional work. I also want to point out the Lieutenant Governor of Pennsylvania here, John Fetterman, who really pushed this in Pennsylvania. And what he found in his tour throughout the state, all 67 counties, was that we need to bring this into the open. We need regulation. We need to make sure we're protecting public health, public safety, but that's regulation, not prohibition. And in bringing it out into the open, as we found in so many other ways and other efforts, this is really an important thing. It's also important that we work together as a region to make sure that we're on the same page. So openness and making sure that we're doing this right is really important, and I appreciate your convening this. Thank you.
Thank you. Thank you very much, and thank you, Lieutenant Governor. Lieutenant governors are also by protocol called governor, so it gets confusing. So thank you, Governor. Thank you both. And Governor Murphy, who, as I mentioned, we do a lot of work together, and the Port Authority as that initiator of regional coordination really did set the template. And I thank the Governor for all the good work we're doing together, and I thank the Governor for being here today. Governor Murphy?
Thank you, Governor Cuomo. Thanks for convening us. Ned, thank you for being a co-convener. Governor Wolf, it's always great to be with you. And to the teams from Colorado, Rhode Island, and Massachusetts. I'm honored to be joined not just by the Senate President, who I'm very happy is with us today, but our Health Commissioner, Judy Persicelli, is going to speak in a few minutes about vaping. I also want to echo what Governor Cuomo said about Elijah Cummings, who was a hero to so many, including to yours truly. I think we have, I did a quick math, we get about 44 or 45 million residents represented by the 4 governors, and I think if you throw in Massachusetts, Colorado, and Rhode Island, you get up closer to 60 million. And it's already been stated, but doing things in an intelligent, coordinated, harmonious way is good for the entirety of our, not just our states, but our residents. And we really are talking about 2 enormous health challenges. And as we see it through the New Jersey lens, we've got an exploding vaping reality among youth, which has become an enormous challenge, health and beyond. And that's something I think we all share. And secondly, we've got a shocking gap between persons incarcerated in our system along racial lines, and it's almost entirely due to low-end marijuana offenses. So putting aside all the other factors that come into the cannabis discussion, the social injustice, at least in New Jersey, screams out at us, and it's why we've come to the table with such passion to try to get this done. And again, I think not just, and the Governor Cuomo mentioned the Port Authority is a very good example and model where you can get a by-state process that gives you a 1 + 1 = 3 outcome. Something more recently, Governor Cuomo and I, early last year after Parkland, as I recall, sadly, we formed states for gun safety. And I think that's a good model. And I'm happy that Dan Malloy and now Ned Lamont is in that coalition, and Tom Wolf in Pennsylvania are signing up as well. And I think it's a good model in the respect that we've each got our own realities inside of our states, legislative realities, what we can or cannot do through executive action, et cetera. But boy, we can be a lot more intelligent, smarter, and have a much more forward-leaning result if we coordinate. And I think that's another good model that perhaps can guide our discussions today and beyond. So thrilled to be here on behalf of the great Garden State.
Thank you. Thank you very much, Governor Murphy. With that, we're going to start our first panel presentation. As I said, we have 5. The panel presentations will start with basically a 5-minute presentation on the substance, and then we'll have a discussion and questions and answers from the people who are here. And let's turn it over now, and we will begin. Thank you very much.
Thank you. I'm Judy Persicilli, the Acting Commissioner of Health of New Jersey. I'd like to have the panel introduce themselves. Let's start with my left.
Dr. Rachel Levine, I'm the Secretary of Health for Pennsylvania.
James Reja, Chief of the Center for Health Promotion from the Rhode Island Department of Health.
Dr. Howard Zucker, New York State Health Commissioner.
Caitlin Wolford, Executive Assistant, New Jersey Department of Health.
Mackenzie Wilson, I'm a Senior Counsel to Governor Phil Murphy.
Miriam Delphin-Rittman, Commissioner of the Connecticut Department of Mental Health and Addiction Services.
Good morning. Renee Coleman-Mitchell, Commissioner for the Department of Public Health from the great state of Connecticut.
Thank you. Governor Cuomo, Governor Lamont, thank you so much for convening this summit. Special thanks to Governor Murphy and Senator Sweeney for the attention that they've given this issue in New Jersey. Just to put it in context, and many of you may know this particular statistic, back in January of 2018, 60 patients in North Carolina in Fort Bragg were hospitalized with vaping issues. Not necessarily lung injuries, but vaping issues. That was back in 2018. On August 17th, the CDC released a report that they were investigating vaping-related illnesses resulting from vaping. Here we are 60 days later, and 26 deaths have been reported. Make no mistake about it, electronic smoking devices pose a threat to public health and should be avoided at all costs. Here's the good news. High school-age youth smoking combustible cigarettes have decreased by 82% between the years 2000 and 2018. Here's the bad news. 1.5 million more students used e-cigarettes in 2017. This marks a 78% increase in 1 year. A 2018 Truth Initiative report indicates that 3.6 million middle schoolers and high school students have reported either using or having tried e-cigarettes. A National Drug Council study reports that this is the largest increase ever reported for any substance in the 44 years of tracking adolescent drug use. E-cigarette manufacturers shamelessly target young people with a growing range of non-tobacco or menthol flavors. Some of the over 15,000 flavors include fruit, dessert, candy flavors, treats, bubblegum, all to allure young users to their products. Although a public health investigation into the cause is still ongoing, we have seen a staggering number of vaping-related illnesses and deaths. The CDC reports that over 70% of the vaping elements they tested include THC. The Mayo Clinic reported that biopsies of 17 lung injury patients showed severe chemical burns, tissue damage from noxious fumes. Nearly 1,300 reported pulmonary illnesses have been associated with vaping products, and you can see it's almost in every state in our nation. There's been 26 confirmed deaths nationwide. In New Jersey, we have 20 confirmed cases, 15 probable cases, with 1 reported death. On September 12th, Governor Murphy issued an executive order calling for a task force to provide him with our recommendations in 3 weeks. The task force convened over 5 meetings and held a public hearing and received and heard testimony from over 250 individuals. Overall, there was really just one agreement amongst the vapers and the non-vapers alike, and that agreement is that vaping products should never be in the hands of minors. Here are several of our recommendations. Ban sales of flavored electronic smoking devices and products. Restrict online sales. Prohibit advertising and sale of covert products. I think some of you have seen the advertisements of products hidden in hoodies. Increase compliance and strengthen point-of-sale practices. Provide for uniform regulations across the marketplace. Centralize retailer registries. Additionally, increase penalties for unauthorized sales. And promote and expand public awareness programs, including our New Jersey program, Incorruptible Us, a social networking and media program that was developed by teenagers. There's been several other state actions, and I'll just quickly go through these. In New York, there's been a comprehensive review of their recommendations. They launched an investigation of companies marketing and selling the thickening agents. They've issued emergency regulations to require warning signs in all retailers and vape shops. They've issued emergency regulations to ban the sale of flavored e-cigarettes. New York has also launched an aggressive enforcement effort against retailers selling to underage youth and banned deceptive marketing to underage youth. Governor Baker in Massachusetts declared a public health emergency on September 24th to ban the sale of all vape products. And in Rhode Island, Governor Raimondo signed an executive order on September 25th to ban the sale of flavored e-cigarettes. Some of the guiding principles to consider at the summit today is to ban the sale of flavored vape products to reduce the attractiveness to youth, implement a vape product safety standard for nicotine, CBD, and other cannabinoids and other vaping products, including additives. Regulate the temperature control, including the heating mechanisms of vaporizers. Between the years of 2015 and 2018, over 2,000 emergency room visits were made in the United States for vaping products that have exploded. Ensure that all vaping cartridges are properly marked or labeled to inform the user of the manufacturer. And increase enforcement actions for unauthorized sales to individuals under 21 years of age. In conclusion, we have a public health crisis here, and we must work together to confront it. Thank you.
Just to get us started, if I may ask a question. Besides Massachusetts, which seems like they are the most aggressive, they banned all e-cigarettes. Besides Massachusetts, we're all basically in the same place. The only question is whether or not we did it by executive order or public health decree or legislation. We did it in this state by public health emergency order, and we got sued. So ultimately, I think all of this has to be in legislation. But are we all in basically the same substantive position, except how we've done it thus far? And if we wind up with a piece of legislation, are we all pushing the same policy?
There's about 14 states that have tried to enact either emergency bans through a declaration of an emergency or through executive order. Most of them have stalled. So we're pretty much all in the same place. A judge in Detroit just yesterday stopped the banning of vaping products, stating that it would put vaping shops out of business. So everybody's pretty much in the same place in terms of needing legislation to move this forward.
Is there such a thing as regional regulation of a substance of a product? In other words, does every state have to test all vaping products to determine whether they're safe or not, or could we do that as a collective?
I'll ask other members of the panel if they have a comment on that. I'm not aware. Anyone?
We could probably do this collectively to test. I was saying that we probably could do this collectively as a group.
Because if we think it's a poisonous chemical or a harmful